Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be. Welcome, everyone. Here we are at the Health In Show, an affiliate program of Homeopathy World Community. And our guest is Dr. Robert Bruck.
Hi there.
And he is my better half. We're going to be talking about snuggling together today in a clove of garlic. And we will have lots of sound effects from the background. And because this is a really fun topic, helpful topic, I'm waiting for something to happen in the background. Nothing? Okay. Okay. So people think about it. I guess October we're going to be talking about Halloween. We're going to be, not really. We're going to be talking about our digestion, our health, and eating garlic, rubbing it in the salad bowl, finding recipes, how to put it into your life every day in the kitchen. And today is October 14th, 2013 on Nissan Communications, Everyday Living with Garlic. Always remember, garlic is a medicine. I did have a quote. If I could find it, I would tell it to you. Basically, it says a clove a day is like keeping the doctor away, better than an apple in some ways. And so it is a medicine. So this you have to be cautious about. Check with your healthcare provider for any drug interactions. We will be mentioning that along the show today, and get regular checkups. Because if you are putting garlic into your new routine, it might change some of the clinical lab results that you receive with your blood pressure. What else?
For the better.
For the better.
For the better.
Right. It's basically a total wellness in a garlic clove.
All right. Give me some garlic.
You want to start with some garlic?
Let's talk about, first of all,
here's garlic.
What it is.
Can you see it?
Can you see the garlic? Okay.
Hold it up.
Okay. Here's my friend, Mr. Garlic. So, what are we talking about? First of all, I am a botanist, a plant pathologist, so let's start talking a bit about the science of this particular plant. Garlic is Allium sativum, okay, in the Alliaceae family, which actually is part of the lily family, for those of you who know lilies. For those of you who also know or don't know your plants, okay, allium is a monocot. All plants are divided into two different categories, monocots and dicots. Monocots are grasses, meaning it sends up long, grass-like shoots that have straight veins. Everybody remember that? Monocots have straight veins. Dicots are like a leaf of a maple tree that has veins that go out in a pattern, whereas monocots have straight veins. So, this is what we know about Allium sativum. What that means, by the way, in English, for all those of you that are out there, you know that sativum is a very common word in the plant community. Yes, indeed, cannabis sativum means plant of the earth. Sativum means of the earth. So Allium sativum means lily of the earth. Okay, and think about where this comes from. It's in the soil.
Don't we put
It's in the
lilies?
ground.
Don't we put lilies? Like, think of it also symbolically as putting it when somebody dies.
That's true. Planting them in the earth. Good point. That's kind of morbid. Okay. All right.
Halloween.
Get rid of my friend here.
Okay.
So, basically, what we're discussing
you want
here.
to say it's a cousin?
Well, it's a cousin. Yeah, basically, our friend here, of course, that everybody knows is the onion. And in the allium family, you have onions, you have chives, you have shallots, leeks. Okay, all of these are in the onion family, the allium family, in which perhaps the most famous of which, from a medical perspective, is garlic. So, what do we know about garlic? It's not new. When we go back and study ethnobotany, basically the history of plants throughout time, and we go back to the tombs of ancient peoples, particularly those in Babylonia, Mesopotamia, and the oldest of them all, the pre-dynastic Egyptians, what do we find buried in their tombs? Cloves of garlic. It was known as early as 7,500 years ago that indeed garlic was a plant that had tremendous medicinal power, and that's in fact what it was primarily used for. Now, before we get into those uses, let me tell you something really interesting about what's going on with garlic today. Let's move up 7,500 years. First of all, garlic is grown in every country of the world. There are no countries, and I'm talking about including places like Iceland and Greenland, that grow garlic. It is one of the easiest plants to grow. Basically, you simply take a clove, you stick it in the soil, and it will grow a garlic plant. Thing that's really unusual about it, though, is that Debbie and I just planted our garlic garden about 2 weeks ago, and we will harvest it in July. It takes 9 months, like having a baby, 9 full months to get a garlic plant to mature. Right now, they're already a foot high. Even from 2 weeks ago, they will overwinter. They are completely oblivious to frost and ice. You cannot kill them with frost or ice. They will survive all winter long and then start regrowing, and particularly putting on the bulb growth in the spring and be ready to harvest in mid-summer. So with that said, basically garlic, as I said, is grown in every country in the world, yet it's fascinating and sad in some ways. It won't be for very long. What am I talking about?
What are you talking about?
What am I talking about? The United States was always a very famous garlic growing country. In our 226 years, Jefferson grew it, Washington grew it, very, very common, and again, mostly used, not just for seasoning, but as a medicine, which Debbie will start talking about in a few minutes. The central growing areas of the United States commercially are Texas and an area in California called Gilroy. Does that ring a bell to anybody? Gilroy is the International Garlic Festival in July every year in Gilroy, California. And Gilroy produced those that rack of garlic I just showed you. The braid was grown organically in Gilroy, California. What is my point? Beginning in 2007, a little country you may have heard of called the People's Republic of China said, how are we going to get into more of an agricultural basis? Naturally, when it came to electronics, computers, and everything, they had already established it. On the other hand, we're dealing with 1.34 billion people. They needed jobs for people, and of course, everybody can't live in the city. There are a lot of suburban and rural people in China, the majority of the people. And guess what they discovered? Garlic. Well, by 2010, listening to me, 2007 to 2010, China took over 93% of all the garlic grown in the world. If you go to Food Lion or Kroger or anywhere else and you see garlic, particularly if they're sitting in a little bag or a box, okay, they are from China. Here's the numbers. Basically, today, China is producing 14 million metric tons of China.
Of garlic.
Okay, of garlic. Of China. Of garlic. 14 million metric tons of garlic on an annual basis. India is number 2 at 800,000. The United States is all the way down to 105,000 metric tons, ranking number 5 in the world, and again compared to 14 million metric tons of garlic in China. Basically, 92.8% of all the garlic available in the world now comes from China. And I'm not going to get good, bad, or ugly, but as all of you know, the Chinese over the past several years have not developed a terrific reputation when it comes to food exports that are contaminated with all different kinds of pesticides, melamine concentrates to boost the protein content of various foods. So, although it is considered to be perfectly safe, we don't really know about that, and hence what Debbie and I are doing very simply, since it is so easy, is grow your own. Right now, if your garlic is coming from the United States, it is coming from California, it is coming from the area of Gilroy, it is at least twice as expensive as Chinese garlic, and that's the whole reason. It was estimated in an article I recently read that by 2017, there will be no commercial garlic grown in the United States simply due to the fact that we cannot compete
but can't we,
with
the
Chinese.
Let's say we take our garlic and we have our cloves. So each homeowner
can grow their own.
Can continue to replant
year.
Their garlic every year. It's you can take it now.
Okay, if this was just brought out of the ground a month ago, a year from now, so long as it's kept dry and in a relatively cool place, perfectly okay. For eating, for planting, for doing whatever you want. So we have 100 plants in. Right now, we'll get 100 bulbs of garlic, okay, which is hopefully enough to last us for a while. So I don't want to get off on that, but my only point is that if you are in Europe, South America, Asia, wherever you are right now, and you are going particularly to a grocery store to buy garlic, the odds are 99% that it is exported from China, and that is the situation. So this is something that has been grown, again, for millennia, and now has become an international, globalized commodity, where China is now growing. I mean, think about it, I'll say that number again. In the United States, we're growing 120,000 metric tons of garlic, all of it, okay? In China, over 14 million metric tons of China per year.
Garlic per year.
Of garlic per year from China.
So, we're going to say this is something that you want to eat every single day of your life. There are people in the world, which I was just reading in India, who don't eat garlic, who don't eat onions for maybe religious reasons, because they belong to a Hindu sect. We were just learning about that. But your garlic, physicians, researchers, pharmacies are looking for the panacea. They're looking for the one thing that is going to be anti-inflammatory, antibacterial, anti-helminthic, anti-tumor, antiviral, antimicrobial, antithrombotic, anti-arthritic. All of those antis,
Lipidemic.
that they put in a little pill that is just like one active component. This is synergistic. This has got everything here.
You diabetics out there.
It's got everything.
There it is.
And
Okay.
hypolipidemic and hypoglycemic. I'm going to go through those one more time.
No anti-spyware.
No
Antiviral.
antivirus spyware. If you put this on top of your computer,
Yeah.
all the viruses will go away.
And you know what?
Take my word for it. I'm a doctor.
I want you to test it as, you have 10,000, 15,000 listeners every Sunday to your computer show. That's on Sunday at 9 a.m. Eastern Time, USA. Ask them to do a test. Take the garlic and put it in your thing. Okay, so let me go through that so that people understand what all those words are. Anti-inflammatory. This is for your immune system. It encompasses literally everything. When you're stressed, you become inflamed and irritated in some portion or organ or tissue or cell in your body. Can I?
Let me say one thing about that, okay? Because it's very important.
Okay.
If you do read the medical literature, some very controversial things have come out recently. Everybody out there in TV land is on statins, okay? Why are you on Lipitor? Why are you on Simvastatin? Because your doc said that your cholesterol is too high, typically over 200 for total cholesterol. You got to be on a statin. Two things. The latest data that's coming out, and of course, by the way, why do you want to have low cholesterol? Because it is going to clog up your arteries. It's going to give you heart disease.
If you have cholesterol.
If you have high cholesterol.
Which is being refuted.
Now it's being refuted, believe it or not.
They're actually saying that when you're older
70 years older, now they're doing a meta-analysis saying you should have high cholesterol. If you're 70 or older, it will protect you against heart disease. Now, what's the corollary? Very important. So what is
word corollary.
What is the heart disease? And the answer is what Debbie just said. Inflammation. That heart disease, clogging of arteries, occlusion of arteries, ending up with an MI, has to do more with the inflammation of arterial valves in your heart, causing heart disease. One of the most important factors of garlic, of allicin, which Debbie will talk about, the chemical, the active ingredient, is it significantly reduces inflammation, which also has a profound effect on hypertension, high blood pressure. While I'm on it, I'll say one more sentence. A study published in the New England Journal of Medicine last month compared a standard anti-blood pressure pill to taking 30 grams of garlic a day. That's about one full bulb a day. The garlic reduced systolic and diastolic blood pressure more than the blood pressure medication. Okay, the pharmaceutical companies are not going to be happy. You cannot patent garlic.
Okay, so I want to make the one usual disclaimer every time on this show.
Yes.
We're entertainment, we're educational, we're informative, we're the health in. We want you to be healthy.
Go to your doctor.
Go to your doctor, bring them whatever information you learn. But this is not to tell you what to do in terms of your medicine. This is for you to become knowledgeable and wise and make your own choices, because I believe in, Dr. Bob believes in health freedom. Okay, Amnon.
I'm going to take you back to growing it.
Yes.
So you take a head
Yeah.
and you break it into cloves.
Break it into cloves, stick the
and
clove
you
in the
stick it
ground.
in the ground.
Right.
So from head, you get about 10 plants.
10.
Approximately 10 plants.
What do you do next year after you harvest them? Can you take the ones that you grew, break apart?
Yes.
And
Yeah.
so there's it's
You
not
harvest them,
inbreeding or anything
you
like
take
that.
them out of the
No.
ground.
Right.
Okay. You dry them
This is
out.
your
Right.
seed
And
for the
next
next
year, that's your seed for the next
This
year.
is your seed for the next
Perpetual.
year. And always when you plant them, this is going up.
Right.
Where he was talking about the monocot, the leaves, and the roots coming out of the bottom. So you plant them that way in the ground.
All right, but you can't
Absolutely.
replant from
Yes.
the same family.
Absolutely.
Yes.
Absolutely.
It regenerates.
Or you could go to a store and buy different varieties.
And,
There's red garlic and black garlic, all kinds of things.
and if you don't do anything
Yeah.
in the ground after you pull them out.
You don't have to do anything.
No.
Yeah.
If you harvest them.
Yes.
Yeah.
And you did not put new ones in there.
Yeah.
Would anything
No.
grow? It's
No.
not like they are.
No,
No, they
you
don't
have to
seed.
have a seed.
Okay.
This is vegetatively propagated. It is
It's
not
a bulb.
seed.
It's like, have you ever planted tulip bulbs and
Right,
they
same thing.
they kind of fade out. They don't last forever unless you put fresh ones in.
Okay.
Okay. So I was just kind of reviewing quickly
Right.
all of these terminologies so that you would understand, and we'll go into a little bit more depth. Maybe we'll have another 5 shows. Okay. Antibacterial, which means you're talking about any kind of infection. So even though influenza is a virus, the problem with people getting sick with influenza is not the flu itself. It's a virus.
Secondary
It's the
infection.
secondary infection of a bacterial infection with a person who has a weakened immune system to begin with. So it has the antibacterial properties. Antihelminthic means that it works against worms. So
All parasites.
Parasites, pinworms, other kinds of worms in the body. Basically, you're making it inhabitable, an environment that's not so tasty. And, we're talking about this odoriferous kind of a plant. They don't like it. It's not conducive for them to live in your body. And I was doing a lot of reading also about Lyme disease, which is a parasite. So as a preventative, not only for you, but your pets. Then we have anti-tumor, which means against cancer, as a cancer prevention. So if you're eating this daily for years upon years and you're increasing your immune system, you're reducing inflammation, and you're increasing the blood circulation, you are going to be helping yourself.
Journal of the American Medical Association, if you eat,
2 cloves.
2 cloves of garlic a day, 2 cloves a day, the incidence of colon cancer on a meta-analysis was down 39%, simply by eating 2 cloves of garlic a day.
So just
That's significant.
Take those stats and do something with them. I want to welcome also to the show today Dr. Kulbushan, Yid Kathy. Is that the cat? No, that's not your Kathy. Dr. Mishra, Dr. Deepak Sharma of the Orbits Clinic in New Delhi. And by the way, prayers go out because of the cyclone there. I know about 500,000 people were relocated just because the waters have gone into the
Eastern India.
Eastern India. Gabrielle Seelman is there, Jalal, and all those who are on the chat, we welcome your thoughts. So somebody had written earlier in here that in India, garlic is used in almost everything. Home except only a few communities, which was also mentioned on the Facebook post. Right. Dr. K says that garlic is considered an herbal medicine for hypertension, lowering cholesterol, and rheumatism. Its oil has a lot of properties. So let's continue with the list of antis, even though, homeopathy is the opposite of anti. It works with the body. So this is herbal kind of medicine, not in a potentized form. Potentized homeopathic remedy also has very important properties. So we talked about anti-tumor, antiviral, so that's also for infections that contagious disease and things like that,
Okay.
that we don't have anything really to deal with,
Time
right?
out.
Time out.
That's perhaps the most significant one of this entire list.
Okay.
As you know, there is no such thing as a very effective antiviral medication in allopathic medicine. If you get the flu, they give you a $150 pill called Tamiflu, in which most flu strains are now resistant to. It doesn't even work, okay? Very expensive drug with tremendous side effects. Antiviral medication is very difficult. God forbid you have AIDS. You have to take 21 pills a day of 3 different antiviral medications. Guess what? From the natural world is antiviral proven in vivo, meaning in life, and in vitro, meaning in petri dishes.
And in humans.
And in humans, garlic, okay? Basically, they did a study of if you have the beginning of a cold or if you have the symptoms of the flu by eating, now important, raw garlic. Only raw, which for some of you out there might be a little rough, okay? Very pungent. But raw garlic contains allicin, which is a known antiviral compound. Basically, by taking raw garlic at the beginning of symptoms, the symptoms are gone. It is literally killing the reproductive, it's the protein code of the virus in the body. It dissolves it. They cannot reproduce. Again, not that I want to knock physicians, but why aren't these kinds of medications on a prescription?
Garlic.
Eat a half a clove of, half a bulb of garlic a day for the next 3 days and call me and see how you're doing, rather than taking a $160 prescription, which in about 80% of influenza cases does not even work. Okay, that comes from the drug companies that it is now resistant. Natural costs you a dime a day to eat it. So antiviral is probably one of the most significant because, as Debbie said, there aren't alternatives. There are lots of alternatives to these problems. You can go on, God forbid, chemotherapy for cancer, or you can eat garlic, but for viral diseases, there are no alternatives.
And don't confuse it with the pills and capsules.
Correct.
Right. Okay.
Correct.
There are many forms of garlic available: oils, powders, extracts, all sorts of different things.
Fresh is best.
There are studies done with extracts and things as well. So let me continue with just the terminology. So we talked about antiviral for the infections, antimicrobial. For 7,000 years, it's been used for tinea, for athlete's foot, and
rub it on the skin.
Any kind of rash. And we're going to get into that, how to apply, how to use these as topically and internally, and whether you eat them or, boil them, or what you do to them. And there are even recipes that are used, drinks that you can take on a daily basis or as an immune booster. Do you want me to keep going? Okay, then antithrombotic is for the blood. We talked a little bit about that, and it's very, very good for the circulatory system, keeping things moving. Anti-arthritic, again, keeping things moving for your joints. Hypolipidemic, which is the cholesterol, and hypoglycemic. Now we're talking about diabetes and insulin.
Okay, quickly, let's review this because this is important. Antithrombotic. Okay, garlic is a blood thinner. That's what people who have heart problems and heart disease take. They take heparin. They take various very nasty Coumadin. Okay? Very clearly, I'm warning people out there, back to the medicine again, if you are on those drugs, you cannot use garlic because garlic is going to super potentize it. Rather, in natural medicine, you'd use the garlic alone. It is a blood thinner. It reduces inflammation and hence promotes circulation in the body. It is anti-glycemic. It lowers the amount of glucose in your blood. That's proven. That is not, again, some sort of old wives' tale. Garlic can be used for diabetes, okay? This is something that we know. Go ahead.
Let me go ahead right here and now talk about the little caution and the warning when you do eat garlic. Of course, you want to build up slowly. Don't overdo it at any one time. So the large doses of garlic may interfere with these medications, as we've said, and reduce the effectiveness of the medicines, or maybe even heighten them. Garlic seems to affect enzymes in the liver that help remove certain drugs from the body. The result could be diminished levels of some drugs in the body. The effect could be particularly important in people undergoing chemotherapy. If you're thinking about taking garlic supplements, always talk to your doctor. Garlic may increase the risk of bleeding. So especially if you also take the blood thinners like warfarin and Coumadin, clopidogrel, Plavix, or aspirin. You need to take a look at not eating all of that garlic. And Dr. Khan Saeed, way back in June 15, 2009, on Homeopathy World Community, was writing articles about garlic. And he said, don't use it if you're allergic to garlic. Well, that's pretty obvious. You could be sensitive to this plant and maybe break out in a rash or have difficulty with your digestion in your bowels. And if you're undergoing surgery, so you don't want to be eating too much garlic before surgery, because then you could be bleeding during that event. And he says also about dental extractions a week or two before then, reduce your garlic intake. So also we said it can slow blood clotting.
Which is what people with heart conditions have.
And so therefore, if you're a person who bruises easily, what do we call those people? Whatever.
Bruise easy people.
People who get black and blue, and they have blood disease.
It's called hematoma.
They have blood diseases. Then I think that we need to do some research into whether garlic would be appropriate for those persons.
One quick interjection. You were talking about the fact that it affects liver enzymes,
right?
And that it could break down drugs faster. Well, let's talk about the positive side of that. Okay, everybody out there in health land, talk about liver cleansing diets. Guess what is one of the most important components of cleaning all the crap out of your liver? Answer, garlic.
Great.
Okay, garlic. Okay, very important, again, in detox diets. You've all heard of that?
Yeah,
okay,
it's a detoxifier.
Detoxifier, again, garlic is a major component. Okay.
Dr. Kubushan in the chat says, when given as one flake to pets for a couple of days, it helps a lot in tick fever. So yes, we're talking about those parasites again.
Right.
So ticks and the Lyme disease, I have more information about that. Jalal in the chat has a question, but I'm not hearing what it is just yet. Let me go ahead and look up that information. One other thing. Garlic can irritate your stomach if you have heartburn, acid reflux, GERD, or an ulcer. There's two ways it can go. One, it can make your symptoms worse if you're really sensitive to the garlic, or oppositionally, because it helps to heal the bacteria, the H. pylori, then it reduces any of your symptoms of your gastric ulcer or your indigestion or your heartburn and your GERD. And all of that sensations may actually just go away as you clean up the insides of your body.
Those of you with ulcers, you heard the fact that it has very little to do with acid. It has to do with Haemophilus pylori infection in your stomach. Garlic, Allison, is a very, very great antimicrobial against that. While Debbie's looking this up, I want to talk about this really quick.
Okay.
Because it's funny. You open up a box of whatever it is, and you look at the ingredients. And on the ingredients, basically, it says, it's got fat, it's got some carbohydrates, it doesn't have nothing else. Vitamin A, vitamin C, vitamin D, protein, 0, 0, 0, 0. Okay? Real quick. 100 grams, 3 ounces of garlic, okay, contains 1 gram of sugar, 4 grams of dietary fiber, 0.5 grams of fat, 7.5 grams of protein, and is loaded. I mean, you talk about taking your daily vitamin, thiamine, riboflavin, niacin, pantothenic acid, B6, folate, vitamin C, 1 clove of garlic is 38% of your vitamin C allocation per day. Folate, calcium, iron, magnesium, manganese, phosphorus. 1 clove is 22% of your phosphorus. Potassium, sodium, zinc, and very importantly, something that you only get from Brazil nuts, selenium.
Yeah.
Okay, very high. 15 micrograms of selenium per clove. Okay?
Per clove?
Per clove. All of that is in garlic. So garlic, we keep on talking about it as a medicine. It's also a food.
Well, it's a vitamin, and this is this is why we really don't can't extract it and just take a component. It's a total
package.
Package.
Yep. Right.
I'm going back to that Lyme disease for those who are interested. Allison breaks down to more than 100 bioactive compounds that interact and combine with one another. This is that synergy we're talking about. And when you put it in food, over thousands of years, people have been putting it in with as a flavoring, as a spice, as an additive. And that also has been, I think of it as like putting together chocolate and peanut butter. That is something totally, wow, it's marvelous. It's something new, and it really has something that does a different way of eating, whether it's chocolate alone. And to me, I eat chocolate and raisins and nuts, and I chew them all together, and it's a candy bar. So in the same way, garlic has all of these properties, and when you put it in your food, it also is something special. Let me finish up on the Lyme disease. As these compounds combine, they form thousands of new therapeutic combinations that microbes can't easily circumvent. Garlic stimulates natural killer cells, the infection-fighting white blood cells of the immune system. And as Dr. Bob says, it's an excellent source of potassium, iron, calcium, magnesium, manganese, it's a very special element, zinc also, and selenium. All of those have anti-cancer properties. So you want to, and I'm going to repeat this again and again, you want to make the internal environment uncomfortable for any bacteria or virus to survive. Lyme disease is the most common tick-borne disease in the United States, with about 20,000 new cases each year. And it was first identified in 1975 when a group of children in Old Lyme, Connecticut, had arthritis-like symptoms. Lyme disease is caused by bacterium B. burgdorferi, and it's carried by deer ticks. So you can see by giving it to your pets, your dogs that are running outside, and you don't want them to be able to have the ticks jump on them. You know, you're thinking this has really got so many incredible properties. I want to mention a little bit about homeopathy also. So why don't you ask your question first, Amnon?
Oh, no, it's not a question. You were talking about, putting it in food. And
yeah.
When Kathy fixes salad,
yes.
we don't use dressing. She takes a pinch of salt and about 4 or 5 cloves.
There you go.
And mashes it. And then,
okay, we need to talk about that.
And then lemon juice of 1 lemon.
Yep.
And that is it. And she mixes it. And
yeah.
everybody always... What did you put in the salad?
Very healthy.
What did you put in the salad?
Yeah.
And she always makes me drink the juice at the end.
So you can see lemon and garlic, 2 potent clarifiers and detoxifiers. You've got olive oil and garlic, and that's another thing that works together really well.
She adds
Parsley and garlic works together. I've got all these recipes. So you can see that garlic is good for the Lyme disease, to the joints, to the heart, and to the nervous system, is all of the places that Lyme disease would affect. I did want to talk about homeopathy and give you a little bit of information about that. One of the things that you're going to come up in the sensation or Sankaran method is a theme. And the overriding theme of, you think about a bulb, you think about it growing underground, you think about it wanting to reach out and push out from the soil its stem and its leaves and its flower. And so it has this sensation of pushing out and being pushed out, being forced out and squeezed. And you know, when you prepare that garlic, you bake it or you broil it, and you squeeze the soft insides out in like a paste to eat it and mix it with your salt, pepper, and your oil. So this is a really good way to, it has a sensation of oppression, being constrained and constricted within the little outer shells of each of the garlic cloves. And socially, it feels excluded, left out. They are not part of the group. So you can see that when the garlic itself first starts to grow, it's one huge bulb. It has not been separated into separate cloves. Only later in the season, when the weather changes, does it harden off and separate. So this is one of the things that people are loving in the stores. I've been reading about it, that they find garlic cloves now that's one huge garlic, that they don't have the little cloves. But you can actually grow them yourself. Yes. And there's been controversy over this, because supposedly coming from China, they might be spraying it with chemicals with Clorox to make them look whiter, all these different things that you don't want. So they were in Trader Joe's. They took them out of their stores because of the controversy. So it's a person who might be saying, I'm feeling left out, I'm feeling neglected, I'm feeling pushed out, and it's all this Liliaceae family that has this type of a sensation. They also have other kinds of things, other kinds of reactions, but this is the majority that you see, that they want to belong, they want to be part of the group. Okay, so one of the thing about Liliaceae, and it is Allium sativa, I don't know how many homeopaths really have used it that much. The most common remedy, homeopathic remedy, is Allium cepa. It is the red onion in the same family that's the number one remedy used for hay fever. So I would think that homeopathically, Allium sativa is going to have very much similar types of symptoms in all of the organs. In the holistically, you're going to see the sneezing and all these other things, even the sexual organs. Every single part of the body is going to be affected. So if you need help with your condition, seek out a professional homeopath. Perhaps Allium sativa, garlic, is going to be helpful for you. Did you have something to contribute?
Yeah, I had a couple of things here that I think are kind of interesting. I did mention before, we're back to garlic again, hypertension, something that I suffered from for a long time. That's probably the most important crypto disease, at least in the United States. Tens of millions of people suffer from high blood pressure. This study that I mentioned before, where there was a placebo, this is a double-blind study, a placebo, a medication, a standard medication, allopathic medication, and garlic was 2011. We're not talking about some old-timey thing. This was published in the Journal of the American Medical Association. The patients that took the garlic every day had lower blood pressures, particularly systolic, okay, the higher number, than did those either in the placebo or the drug category. So it worked. It controlled hypertension. One of the really cool things that I learned about this years ago, that I'm just going to mention, and it has absolutely nothing to do with medicine. Okay, you are very wealthy and you have this unbelievable hand-blown glass and porcelain collection, Chinese porcelain. And your doggy jumps up on the shelves and knocks a piece of porcelain on the floor and it breaks in half. Okay?
Yeah.
Well, what's the first thing you're going to do? You say, well, I could take
Crazy glue.
a crazy glue, super glue, Elmer's glue. Wrong.
Wrong.
If you are a restorer of fine porcelain,
Oh my.
you squeeze garlic into a juice. Take the juice, which is a garlic-derived polysulfide chemical in the juice, put it on, stick it together, and you will have a permanent bond on porcelain without any damage to the surface, any damage to the glaze on it. Okay, who would have thought? Okay,
Well,
garlic
it's sticky
juice.
when you open it.
It is sticky.
It's sticky. It has
Do
a-
it. That is a polysulfide.
Oh, we need to show.
Okay,
We have a demo.
we have a demo.
Okay.
Am I doing the demo?
Okay. So what you do
Explain.
is okay. What you do is you
Explain.
take your take your garlic. Now I did cut on the bottom, scored it because I wasn't sure it was going to work. But this is all over the internet on videos demonstrating. You know how hard it is to peel off each individual shell? Is that what they call
Yeah,
them? Shell?
the shell.
So you put it into a container, and you put, there you go. You put the top on.
Okay, this is from Martha Stewart. We stole it. Okay.
It's not, wait a minute. They can't see it. Let me try it. I don't know how long you're supposed to do it for. Did it work?
Ooh.
Well, it's supposed to have separated.
It
all
did.
Oh, look. It did it. Can you see that?
Look at that.
Where's the camera? It took.
It takes all of that stuff off the outside, the husk off the outside.
And these are very fresh, so it makes them even harder. And I want you to look. There's two different kinds. This is red.
Red. Yep.
This is red, and then this is white. So, you know,
there's actually black garlic, believe it or not.
Black garlic.
Black garlic.
So that's the trick for opening your garlic instead of sitting there for hours. And I do this.
Good.
It works good. And then what I do is I take all of these whole cloves and I put them in a jar with olive oil and I keep them in the fridge. And then whenever you want to cook anything, they're already ready to go. Just a huge jar of them.
So you have a cold coming on, folks.
Eat it.
You take this, put it in your mouth, chew it up, and eat it, and the virus reproduction goes away. How's that?
Okay.
That's about maybe a cent, 1 penny worth of garlic.
Now, Kathy takes
I wanted to say.
when we buy,
Yeah.
she buys
Yeah.
it, and she'll squeeze them all in.
We need to
Right,
talk
and
about
then
that.
she'll
Garlic
roll
press.
it.
No, we need to
she'll
talk
press
about
them,
this.
and
Yeah.
she'll roll
Yeah.
she'll roll it in plastic,
Right.
and put it in the
Oh,
freezer.
to make
Yeah,
a paste.
And
that'll
then when
work.
she's ready to use,
Sure.
she'll just take it out. So
Sure, you can
that
freeze-
does-
you can freeze
you don't
anything.
lose any of the
That's
fat.
correct. You do not lose it.
Okay.
The only time, by the way, all of the properties, anti-inflammatory and everything, cancer, you can cook the hell out of it. No problem. Cooked garlic is fine. Only the antiviral properties must be fresh, or in this case, frozen, and then eaten fresh.
Okay.
That's where the components come
One
from.
of the things that you're repeating again and again, and it's really important, the way that Kathy is preparing the garlic is really important. And that is to crush it, chop it or crush it, and let it sit for even 5-10 minutes before you actually cook it or use it or
Yeah.
make it into your salad, because that is eliciting more of the healing properties of the allicin.
Right. It oxidizes the allicin, which makes it more potent.
So she's doing it correctly, and it does take a couple of extra minutes before you're ready to go with it. Let me see what else I've got here. We did that tea tree oil. No, garlic has germanium in it. This is really a fun fact.
Yep.
Germanium is an anti-cancer agent, and garlic has more of it than any other herb. In lab tests, mice fed garlic showed no cancer development, whereas mice that weren't fed garlic showed at least some. In fact, garlic has been shown to retard tumor growth in human subjects in many parts of the world. And I mentioned all of that. Here's something. Garlic, people don't want to eat garlic because of the odor, because of it getting on their hands and smelling and in their skin. And that's really an important fact about it. There are ways that you can reduce that a little bit, and that is with lemon juice, parsley, which is high in chlorophyll, so you're green, so I take a green drink, and also milk. So there were some studies about that. Can you look up in the People's Pharmacy? I think Joe and Terry Graydon in the People's Pharmacy had something about...
Okay, you look it up while I'm talking.
Okay.
Basically, we're talking about the historical use of this product. I mentioned the fact that it is one of the oldest known medical devices that have ever been used. Basically, we're talking about Hippocrates, Galen, Pliny the Elder, Dioscorides, Confucius, all wrote treatises about its use on parasites, respiratory problems, poor digestion, okay, and we specifically have data from China going back to 2500 BCE, that's 4,500 years ago, where it is written that garlic was used commonly as a medicinal plant. I found a quote earlier today. I was showing Debbie, that's hilarious. Actual quote. It is 1864. The Union Army, the Southerners here are not going to appreciate this. The Union Army is in Maryland heading into the South. 20,000 soldiers, and Ulysses S. Grant, General of the Army, sends a horse rider back to Washington, D.C. My army will not move without an immediate shipment of garlic. 2,000 down with dysentery will wait for your delivery. 3 trainloads of garlic arrived from Washington within 48 hours. Grant fed it to his troops and then went on to ravage the southern United States. So if you're a Southerner, garlic is not high on your list of friends. Literally, the army was down with dysentery, and we all know what that means. Garlic cured them.
Right. So it's really wonderful for those kinds of diseases. In 1615, written in a deep snow, quote, "Our doctor is a good clove of garlic."
Unquote.
Garlic, this is Nicholas Culpeper, really famous herbalist.
Yep.
Garlic provokes urine in women's courses, which is menses, menstruation, helps the biting of mad dogs and other venomous creatures, kills the worms in children, purges the head, helps the lethargy, is a good preservative against and remedy for any plague, sore, and maybe that's where the plague, you think of vampires.
Vampires. Thank you.
Sore and foul ulcers. We talked about ulcers.
Yes.
So not only internally in the digestive tract and the stomach ulcers, but also externally on the skin can be used as a compress, as a rub. But remember, you need to dilute it because it is also an irritant. It takes away spots and blemishes in the skin. It eases pains and ripens and breaks abscesses and other swellings. And I wanted to tell you what...
the Culpeper herbal is 1560.
1560.
1560,
so
yeah.
we're going back a little bit.
Yeah, a little bit.
Okay, so this was the story in the People's Pharmacy, Guide to Home and Herbal Remedies. There was a story about Stan who had suffered heartburn and ulcers and was treated for the
Helicobacter pylori.
Helicobacter pylori. And, people would say you have a very bad odor from your mouth, your breath. It smells bad. And so basically what happened by eating garlic, he cleared away the bacteria inside and everything cleared up. His breath cleared up and he wasn't put off by his girlfriend. And this is one of the things that I keep mentioning as a major theme, as being pushed out, left out of the crowd, not part of society. The garlic has this really strong odor. You can walk into a home that's cooking with it and it's delicious. It invites you to come in and have a meal. But on the other hand, if not everybody's eating it, you can have it exuding out of your skin, and there was no way that it would be cleaned up. Let's see what he says. The dispute over garlic breath has been raging for a long time. In the 1930s, doctors carried out a heated debate on this topic in the Journal of American Medical Association. One group of researchers maintained that garlic breath originated solely in the mouth as the results of particles sticking to the teeth, tongue, and tonsils. Their prescription, a popular mouthwash of the day that was supposed to deodorize the garlic particles. This claim was hotly contested by other physicians who maintained the smelly volatile oils of the garlic are absorbed in the stomach into the bloodstream and exhaled from the lungs with each breath. Do you have something to say?
No.
A team at Yale finally put the issue to rest by reporting the results of their research. They enclosed the fresh garlic inside double capsules so no particles stayed in the mouth. The experimental subjects who swallowed the garlic capsules as if they were vitamins developed distinctive garlic breath within 2 hours. Vigorous mouthwashing did nothing to eliminate the smell.
So the blood.
So they carried out in this experiment in the labor and delivery room at the hospital, and women in the first stage of labor took garlic capsules which produced garlic breath. When their babies were born, they too had garlic breath, which lasted from 4 to 20 hours. So parsley is the one thing that has
If
been...
you and your girlfriend both eat garlic, it doesn't matter because you both stink. Okay, here's another anecdote.
And it cleans up your skin beautifully.
That's because all the vitamins and minerals. Okay, what do we call Englishmen back 200-300 years? Okay, how did the English conquer the world? They became limeys. What is a limey? They put limes aboard their ships so they wouldn't get scurvy. Okay, well, guess what they also discovered? You know, the British were always on the high seas discovering things. That existed for 200 years by having their sailors eat limes. Beginning in 1912, they discontinued putting limes and citrus fruit, which of course spoiled, on their ships going around the world, and stored kegs of garlic because 1 clove of garlic a day is enough to completely ward off scurvy.
Vitamin
and it
C.
lasts forever because of the vitamin C.
We only have a couple minutes left. I want to leave you with a recipe, maybe more than one if I have time. It's a medicinal drink. You take a cup of milk, and if you can get raw, fresh milk, that's the best. You take garlic cloves. 3 garlic cloves. Sugar to taste. And turmeric. And I would use the real raw turmeric, but powdered turmeric works just as well, 1/4 teaspoon. Some honey, if you like, and black pepper powder, a pinch. And what I've been learning is that there's a synergy between turmeric and pepper that makes it work even better, as turmeric is really an antiseptic and anti-cancer.
Yep.
And I also eat this almost every single day. So when you put this concoction together, you're going to end up with a very delicious drink. Put it into your blender, and of course you can do that crushing of the garlic first to get the properties to come out. You can bring this milk to a boil. You can make it into a warm drink. And I remember when I was a little girl, my best friend was from Baghdad. And when I had the influenza, I was staying at her house, and she gave me this strange drink. It was milk and honey and garlic, and to help me. So this is a popular drink. The other thing that I love to do with garlic is make a pesto. So you take a whole bunch of either cilantro or parsley, put it in the food processor with a number of cloves of garlic, as much as you like the powerful.
What happened to basil?
Basil, cilantro, or parsley, a combination of any of those. Lemon juice, lots of olive oil. Garlic. You could throw the pepper in, and you whip that up and make into a paste as a side dish, as a spread on carrot sticks or celery sticks or toast or crackers, whatever you have. It's phenomenal. Did I ever bring you any? I'm going to have to bring you some. It goes really quick.
I'm just thinking, why? I mean, think about V8.
V8.
Yeah.
Why can't they put 2 cloves in there?
Because a lot of people probably wouldn't like it.
But some will.
Some
We'll
will.
have one with garlic. And
I bet you there has to be a vegetable drink that has garlic in it.
There must
Got
be.
to be.
I don't know. There you see all kind of things, vitamins.
Well,
that they
you
add
and
in
I are going to
calcium.
invent it.
Well,
Oh, they add all those additives you
I
don't
know,
really
they
need.
put all kind of things. You look at all kind of drinks
But
and
they're-
milk and all this. It has vitamin D. It has calcium. Extra this.
Garlux.
Why don't you put
A clove of garlic.
clove in there?
Sure.
Well,
Chop it up.
the thing about all of those additives, typically they're not assimilated. They're not absorbable forms, so it's kind of a waste.
It doesn't
Very-
matter. My point is that
Yeah.
they add stuff. Why
Right.
not add? This is so cheap to add it.
Yes.
Okay, well,
I'm just saying.
you can start something.
There you go.
Invent it.
We're patenting that.
We
Don't
have
get any ideas out there.
Dr. Wakar in
I
the
could have had a V8.
Dr. Wakar says he uses boiled eggs with pepper and turmeric. It's called haldi. Gabrielle says the studies by many researchers show that the garlic is an ancient crop. Even in ancient Indian medicine,
Yes.
was the garlic estimated value. Dr. Wakar tells you that the pharmaceutical industry will be shivering from this show.
I hope so. Well, it's amazing. Let's talk about that for a second. I mean, look, I'm a scientist. I'm one of these guys that believes in medicine and believes in pharmacology. Yet, when you take a look at the actual proven double-blind studies that have been conducted with garlic, just plain old garlic, and the kinds of benefits that it actually delivers to people who will just do it. I happen to find it delicious. Even if you don't find it delicious, okay, you take it as if it was a medicine instead. And the amount of benefit you're getting from it versus these multi-$100-a-week drugs is really something. And again, the pharmacological industry does not want to hear about it.
And it'll keep your enemies away.
And if you don't believe in it,
Yeah.
other than if you're taking blood thinners,
Yes.
can it hurt in any way?
No. I actually,
any other situation?
I looked at what is the toxic dose of garlic, and you'd have to eat 100 of these a day. Okay. As Debbie said correctly, some people are more sensitive.
If you're sensitive,
they're going to get reflux because there's oil in here. There's essential oils in here, just like you'd have any other oil. You have to figure it out yourself. Okay, I can eat an unlimited amount I have other than burping, okay, and other things from the other end that we won't talk about. Okay, I have no negative effect. It makes me feel fine. But the answer is that if you took a couple of cloves, not the whole bulb a day, put it in your food, ground it up in a drink, okay, could it do any harm to you other than the blood thinning effect, which for people not on the drugs is good. That's why, take an aspirin a day, the doctor will say. There's your aspirin, okay, to prevent clotting in your system. Other than that, there are no negative effects.
And I'm going to mention from the Materia Medica in homeopathy, this has been known. Garlic, the liliaceae, the tincture of the fresh bulb, clinically is for alopecia or hair loss, balding, asthma. We didn't even mention how important. They just did a huge study showing that instead of your medication, garlic is going to help asthmatics.
Why? Inflammation. It relieves inflammation. Asthma is an inflammation of the bronchial tube. Simple as that.
Excellent. Bronchitis, which is the secondary infection. Catarrhs, which are the discharges, the heavy, thick discharges. Colic, we mentioned that the babies whose mothers who ate the garlic did not have colic.
Right.
Constipation, so it keeps things moving. Coughs. Dandruff. I didn't look up that coxalgia. Did I look that up?
I don't
remember what that was. Diabetes, diarrhea, dyspepsia, fevers, headache, rheumatism of the hips specifically, hoarseness, menorrhagia of the menstruation disorders, ophthalmia for your eyes, rheumatism, salivation, scurvy you mentioned, affections of the skin. It even says sprains and whitlows and worms. Those are just the clinical itemization from the Materia Medica. And then you could probably go through the repertory and see the different rubrics for each one and what people are saying, and see if you find that theme of being pushed out, being squeezed out, being excluded. That came from J.H. Clark's Materia Medica. One of the things I kept reading is we don't know how it works. Possible explanations include the chemical effects on drug metabolizing enzymes, antioxidizing properties, and tumor growth inhibition.
Right.
But actually, when you get down to it, it's all theory. It's all experimentation. They don't really know how.
It's not theory. It's proven. But the point is that we just said is that will the pharmacological companies do the biosynthetic pathways to figure out what's going on? Of course not. You can't patent this. This is not a drug. It is not a medicine.
But what they're doing is they're working with aged extracts now, and they're finding them highly potent. Aged garlic and garlic oil as preparations. So maybe you're going to get a prescription for that. The other important thing that we didn't mention is the organosulfur compounds. It's the sulfur. It's that smell like you got from when you're cooking an egg. It's the sulfur. Mm-hmm. And that is the attribute to the chemopreventative activity and shows anti-mutagenic activity, which means that things are not going to mutate. Is that what it means?
If cells don't mutate, they're not going to get cancer.
So it's the aged garlic extract that exhibits radical scavenging activity. So we're talking about removing those free radicals in the body. Garlic will do this too.
It is an antioxidant. That's what free radicals are.
I know we're out of time. We're over time.
Right.
So we have these chemicals, and we'll talk about that later. They did experiments with mice, but we can also say that people have used it. We talked about crushing it. Do that. You can bake it. It won't. It will remove some of the properties, but still good.
Only the antiviral properties. That's all.
Okay. And when you look for garlic, you want to plant it, you want to eat it, look for organic or heirloom garlic. It comes in varieties of hardnesses, clove types, colors, storageability, flavors from mild, moderate, strong, sweet, and spicy.
Now let me interject
something. So you can
something.
find all of those.
Okay, one of the problems that Debbie just said is that right now, like this, okay, you can buy either online or at the store, okay, Whole Foods, places like that, organic certified garlic. This is all from California. It's where it's grown. That's USDA organic certified. Unfortunately, and I can't badmouth it because I don't have the data, if you buy the Chinese garlic, which is what most of you are eating right now, this is not certified organic, and you do not know what is in it. And so those of you who really want the organic are going to have to demand that and accept the fact we're going to pay higher prices, typically double for a California-grown organic garlic versus the Chinese-grown, okay? This is simply a fact of life. Let me make one other compliment to our Indian friends that are out there, because I think it's very important. Natural products chemistry, where an awful lot of this research is going on right now, probably 80 to 90% of it is in India. Okay, India has been on the forefront of natural products, medicine, and chemistry, particularly since World War II, when the pharmaceutical companies, okay, basically started taking over everything, get patents on drugs, and yet, due to natural medicine, homeopathy, okay, the Ayurvedic medicine that takes place in India, they are doing much of the research where these data come from today for us to be able to eat and have a natural lifestyle. Thank you, India.
Okay, well, that's it for our show. If you want to learn more about vampires and other kinds of and other kinds of facts, figures, research, and tidbits and recipes about garlic, let us know that this has been an interesting topic. Next Monday, we're going to have Chris Gunnar talking about healthy and unhealthy oils that we use in the kitchen. And that's going to be a lot of fun, too. On Thursday, Alan Phillips and I will be talking at 1 p.m. Eastern Time on Blog Talk Radio about vaccinations and your rights in the United States, current events around the world, what's happening, why are children being forced by courts to be vaccinated. This is really, seems quite unconstitutional, taking away the guardianship of the parent from their own children. These are questions that we have. We have many others, especially as information about data comes to light about the effects of vaccine ingredients. I want to thank you, Dr. Bob, and you're going to be
pleasure.
You're going to be a regular, I'm sure.
Wade, but he's retired.
Yeah, yeah, he's going to be my partner in doing the show here. And I want to thank all those folks out there listening, wishing to the people who are not doing well with their weather conditions or their health. Our prayers are really, really important. On Homeopathy World Community at Facebook, I have been putting a number of quotes about the meaning of connecting with prayer and with God, with Creator. Whatever it is that you believe, you might find those quotes or thoughts interesting. Please share this show on Twitter, on Facebook, on Reddit, Stumble Upon, Dig It, whatever it is called, on your emails. We would love to have more listeners. And, one other thing, brighten your life with Linnea Hahn's Sunshine Sciences. There's a coupon at the bottom of the screen, right?
10% off.
Right?
Wow.
10% off if you put the word health in. I have been using these light bulbs. They're full sunlight.
10
You
years.
won't find it anywhere. They last for 10 years. They're well worth it. If you are in the United States or Canada, she's working on a product for Europe and India. So if anybody wants to be a sponsor, give me a call at homeopathyworldcommunity@gmail.com. I want to thank Amnon for going over time today. I know this was a blast. Fun facts.
Thanks, Amnon.
Thank you.
We love you, everyone out there. Come back next time, Monday at 11 a.m. Eastern. I think it's 9 p.m.
Whatever.
in India.
And eat your garlic.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Sundays, 9 a.m. till noon. Carrie's Psychic Cafe with Carrie Silkowski, Sundays, 8 till 9 p.m. Health In with Debbie Bruck, Mondays, 11 a.m. till noon. Breaking Free with Marilyn Shannon, Mondays, 1 till 2 p.m. Lessons of Vietnam with NCVVI members, the second and fourth Wednesday of each month from 7:30 till 8:30 p.m. Reawaken Your Brilliance, Julie Seibert, Wednesdays, 9 till 10 p.m. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by ThatVidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.